Shagun Aggarwal. I'm a specialist plastic surgeon here at the Sydney Adventist Hospital, and I also work at Royal Prince Alfred and Prince of Wales. So skin cancer in Australia is unfortunately so common. I think across the world we have one of the highest skin cancer rates in the world, and unfortunately we also have one of the highest rates of melanoma in the world. So skin cancer is a broad category. The bread and butter skin cancer is a BCC, which stands for basal cell cancer. That accounts for about 70% of all skin cancers. The other second category is squamous cell cancer, or SCCs, and together those two categories form about 90% of skin cancer. So that'll be the vast majority of things that affect people. And the types of people are generally people who are genetically predisposed. So naturally the people who are lighter skinned, have blue eyes, blonde hair are going to be most at risk. But that's not to say other people won't get that as well. The last category is melanoma, which is always a little bit scary to talk about because people worry that that's a type of cancer that they associate that can spread around the body. And that can be true, but that's a smaller group. It's about 10%. So the people who come to me would usually come as a referral from somewhere else. Often it's from their general practitioner who they've gone and seen, and there's a lesion that's been growing somewhere, and they're like it bleeds or it itches or it just hasn't gone away, and they've gone to someone to see, and that person has said, yep, I agree, this is something that's not quite right, and they'll usually refer it to me. The other people that I see referrals from are skin cancer specialists or from dermatologists. And because they're experts at dealing with that every day, they will usually either diagnose the condition, take a biopsy, or even excise those simple skin cancers before coming to me. So my expertise as a plastic surgeon is really dealing with skin cancer anywhere. And I'd say that, anytime it gets a little bit more complicated, something that's a little bit bigger, that needs a little bit wider clearance, and pretty much anything on the face, people will generally come and see me because they're concerned about the cosmetic result long term. So I think that's where plastic surgeons truly are the cancer doctor, but also respecting, what you're going to look like long term. So for a BCC and SCC, if it's something like on the face, it partly depends on the size, but those skin cancers rarely go really anywhere else. So once they've been excised and the clearance judged under a microscope, that's well and truly gone. And what I say to everyone is we need to have an insurance policy, which is called a rim of normal skin around the spot. So whatever spot you come in with me, I'm unfortunately going to have to take a little rim of normal skin around it to make sure we've got it all, which means we've now created a defect that's larger than the problem you came to me with. And then depending on where it is, we'll work out how to reconstruct that. So the difficult spots are things like on the nose or the ear or the eyelid, where there's unfortunately no loose skin. The other areas like the forehead or cheek or chin or neck have a little bit of loose skin, but again, after a certain size, we again are in a bit of a challenge on how to reconstruct that. So in terms of reconstruction, the things that I often do are to move skin around the face. That's called a local flap, where in the short term it means creating some additional scars, but we move skin from an adjacent area where there might be a little bit more loose skin, or just distributing that tension over a broader area. So by making a larger scar, we can actually move skin around, but then the end result is the skin's always been there. It's the same color, shade, and texture. And once the scars heal, hopefully in little skin crease lines, long term, it will look really good. But I do warn people that, in the short term, local flaps, you'll be able to see the scar. It'll be a bright pink scar that people will be able to see from the end of the room. But we do teach them ways to improve the scar long term, and it takes about 3 months. But I aim for about that 3-month mark for scars to be, very well settled or imperceptible. On the other hand, sometimes we can't move skin around, or that could just be the nature of someone's skin or the size of the problem that they've come in with. And in that scenario, we do have to borrow skin from somewhere else, and that's called a skin graft. And a skin graft, we try and borrow from areas that match that skin closely. So for instance, if you've got a skin cancer on your face, we'll try and borrow skin from somewhere that's got the same color. So that will be this area that's been sun exposed, so often from the neck. So if it's from the neck or in front of the ear, sometimes even the hairline, once we stitch that new skin in place, it'll pick up a new blood supply. So I warn people while it's doing that, don't judge the reconstruction. It takes 4 to 6 weeks for those skin grafts to mature. They don't look very pretty at the start, but the technique's very important. And long term, I think they can do really well. And I think certain areas where they do really well are like the tip of the nose, even on the ear, they do really well. I'd almost argue that's actually a better reconstruction than anything else. So I think skin cancer surgery is just something that's so common. It affects, unfortunately, a lot of Australians, if not all. And it doesn't have to be disfiguring. It can look really good long term. And what I say to everyone is it's about making it a pleasant experience, not just during the consultation and during surgery. So during surgery, I say to people, there's no reason to be ultra brave and just have everything under local anesthetic. You don't have to be asleep, but you can have a little bit of sedation, something to just take the edge off and not be aware of what's going on. And you recover quickly, but you're not aware of the pain and those aspects of it. And long term, if you can look pretty good, the really nice thing about that is, I say to people, if you've had one, you're probably going to have more skin cancer. And you want it to be a pleasant experience. You go, yep, that was really good. I didn't feel any pain, and I looked really good long term. So if I have my next one, I'm not going to be worried about getting that checked out and then going to the surgeon. What you don't want is someone to have a bad memory of it. They either go, oh, that was a bit painful, so I'm just not going to go. I'm going to go when I really need to go, often when it's very big. Or on the other hand, I'm not going to go see the right surgeon because I didn't like the result. So I really like, when patients come back and they say, oh, that was really good, and I can't tell where that was. Next time, I'll get onto it quickly, and it won't be an issue.